on our next speaker, and she knows all about innovation. She's the Innovation Manager of Southeastern Sydney Local Health District, which is leading a range of district-wide strategic and operational initiatives with the objective to bring new ways of supporting best practice, developing capacity, capability, and facilitating idea generation. I like that. And directive seed funding. So let's call on Jocelyn Hickson to help us with generating ideas this morning. Please welcome her to the stage.
Welcome you here today. I'm actually presenting on my boss, who is the Director for Improvement and Innovation. So I take up the innovation component of this hub, and we also have an improvement manager who does the education component. This is normally a half-day workshop that I'm going to go through, so within the next 15 minutes, and Jess, please keep me to time, and I'll try and do my best, but I can make all these resources available online as well. So, innovation. I wanted to just quickly, tell a story about where I came from and how I actually got involved into innovation. I was previously working at Western Sydney LHD, and now I'm based at South East Sydney, but I was in Palestine in 2013 and walking the streets, and I came across this gentleman, and he was talking to me about what he did, and he actually said, oh, hang on, let me go get something. And I was telling him about how I work in innovation. He said, innovation, and he actually put this teapot on his back, and he walks around the streets and delivers tea to his community, and that's how he engages with the community, but his innovation is actually a teapot. And today I really want to get across the message that innovation isn't something to do with an app or, Apple or Google. It's just an idea, and it's just a practical idea. So if that's something that we're talking about, innovation and engagement and how we really can communicate with our communities today, it's not necessarily an app or it's not necessarily IT, it's just something practical and smart. So I just wanted to tell you quickly about the iihub. I won't go into too much detail. Speak about the culture for innovation and introduce the topic of the School for Health and Care Radicals. And this is something from the NHS. The Go for No program. Some people will love it, some people will hate it, so it's up to you what you want to take away from this session. And also the model for improvement. So if you have an idea, how to actually practically implement and test that idea. So why did we want to actually introduce the iihub? We've been around for about a year within our district. We look at system-wide safe care. It meets the triple aim, which you can see the model here, and it's a lot of international best practice that we're bringing today, but we are a hub. We're incredibly tiny, but our motto is about bringing people together. So not only patients and consumers, but also our different services that we have within our district and across New South Wales Health. So how we actually started is simply by listening, and we actually undertook, instead of sending out a survey to say what works, what doesn't, we actually undertook something called the Big Conversation, and that's where we went and spoke with over 800 staff members, and we asked them 3 simple questions. And this is based off the US Flipping Healthcare. I'm not sure if anyone's read the article before, but it's really, instead of saying a clinician saying to a patient, what's the matter to you, they ask what matters to you. So it's really flipping the way that we actually treat our patients, and that's what we wanted to try and do and engage with our staff. So we asked what matters to you, what works well in your workplace, and if you could make a change in your workplace, what would it be? So we had so many ideas, so many suggestions, and we really engaged with our staff members. And from that, we've built some reports, and we now have a strategy, and we're working on 5 key areas of wellbeing, leadership, communication, teamwork, and management. So how do we actually build capacity and capability within our workforce? And for the last 18 months, I've been working on 10 innovation and integrated care projects. Some of you might know the intensive English centres where they do screening for newly arrived refugees. That was one that we put funding into, and it's a fantastic project. And that's something that's a simple idea that you're able to really just take charge of and bring people together across education and health to really try and link in with our community. There's something called Change Day. I'm not sure if anyone heard of it. We tried to do a Twitter social movement, and Change Day is something that they've implemented in the NHS in the UK, and it's pledging to do something different on one day in March 2016, and we did it this year, 2015, Twitter, unfortunately, in Australia isn't as big as it is in the UK, and so our trending wasn't as successful, but we've taken a lot of learnings from that and looking at different social media platforms for this for 2016. We're doing a lot of training and aligning efforts, and we celebrate all our achievements through our bright spots and through the awards, and I do know Michael's presenting on one award that was successful as well. So the culture for innovation. In health, we come across this frequently to say, that's really innovative, that's great, but we can't do it because it's never been done before. We're really risk adverse, and we have a lot of policies and procedures that actually they do promote this. So how on earth could we really try and do something that's quite different and risk-taking? And that's through something, this is a school for health and care radicals that's based in the NHS. Anyone can go online and do it's 6 modules that you can do, and it's really just some components, and I wanted to try and touch on some of that today. So they talk about rebels, and you can take this as, you can call them change activists if you like. They're just people that are trying to question the status quo. And so they're change initiatives, and they do it for causal actions. They don't wait for permission to lead. They innovate and they strategize. They are responsible and they do what is right, and they name things that others don't see yet. So a lot of people are in the system and they just do what they're meant to be doing, and they're told that that's how it's done. But through this program, and through, if you can find some people in your workforce that actually might be, a little bit of a risk taker, this is something that you don't have to call them rebels, but you can call them your change friend. And what they really want to try and promote through this School for Health and Care Radicals is fostering ideas outside your comfort zone. And you do that through hubs, you do that through linking with different people, not within your workforce or through your consumers or your patients. It's actually linking outside of that and really trying to build that diversity. And how you actually do that is going to the edge. And this is a really interesting quote that they say, leading from the edge brings us into contact with a far wider range of relationships, and in turn this increases our potential for diversity in terms of thought, experience and background. Diversity leads to more disruptive thinking, faster change and better outcomes. And how do you actually start from the edge? So you still have to have one foot in the system. We still have to do what we're doing and follow those policies, those procedures, and our reporting, that's fine, but still always have that one foot beyond. You actually pull in assets, ideas and knowledge, and you build on those connections, which is something I'll talk about in a moment. You conform and rebel, and you can't be a rebel on your own. You actually have to have people with you. And that's where you can actually differentiate between a troublemaker and a rebel. So a troublemaker, they may complain, they're angry, they're pessimistic, but you can alienate, and they actually feel alone, and they always see the problems. But a rebel is that they're creative, they're optimistic, they look at the possibilities, and they're very together. So I just wanted to touch on weak ties, and this is something that's really interesting about hierarchy and connections. And this study, and I can send you the links, is more about how you can be people who are highly connected have twice as much power to influence change as people with hierarchical power. And if you think about weak ties and how you can actually link in, so your strong ties are people who you work with every day, you feel comfortable in raising an idea with, actually doing something. But your weak ties are people who you normally wouldn't really connect with. You might say hi in the corridor, or you don't even know. And I'm sure there's people today here that maybe in our lunch break we can really link in with those weak ties. And that's where you can actually get the most change. Now, generational diversity, this is one of my key topics that I absolutely love to talk about, because we talk about the baby boomers and the Gen X and the Gen Y differences at the moment in the workforce and also in our communities. But does anyone know about the next generation that's coming up called Generation Alpha? So these kids are born after 2010, and are we in for a shock? They are going to be the most tech savvy, they're going to be the most educated, they're going to be superior negotiators, And we, in 20 years' time, will be having this discussion. How do we actually work with these people? So the baby boomers and the Gen Ys, now we're trying to work as it is, and how we really try and engage with our social media, but in 20 years' time as well, where are we going to be? So something to really consider as well. In our communities, we still are working with all generations, and how we communicate them is something we should be thinking about. This is something about social movements, and through Change Day, something we were trying to do. Social movements at the moment can be really empowering, and something you could really try and target one specific area and use it. But this is an article through Helen Bevan, and she actually runs the School for Health and Care Radicals in the UK. I won't play the video, but I'm sure a lot of people have seen the Lone Nut in YouTube, where one person dances and they actually bring a lot more people, and it shows how one person can actually make a movement. So if you do have an idea, don't be afraid to raise it today. And disruptive innovation. So you think about innovation already and you think, oh gosh, it's quite, it can be overwhelming. And then people talk about disruptive innovation. You're like, oh my goodness, just go away. That's just too much innovation for me. But really, this is where we can actually get the change, and where we can actually see some amazing items happen. And this is just one example of disruptive innovation. And you think about, what do we use a mobile phone for? And in a workshop I ran last month, I asked this question. And instead of someone saying, to make a phone call, I said to check the weather. And that's exactly what disruptive innovation is. It's not, the purpose of the mobile phone when it was created was to make phone calls and to text. And well, not even to text, to make phone calls, to communicate. We don't even think about our phones anymore in that way. And that's a prime example of disruptive innovation. So this is a model that I've been introduced to recently, and it's from the US. So like I said, you'll either love it or you'll hate it, but it's about the go for no. And this is something in my workforce, I always get no's coming for me. And so now I have this big thing in my office where it's how many no's I can get for an idea. And it's really embracing, so it's changing your mindset. And it's yes is the destination and no is how you get there. So instead of avoiding rejection, you increase it. You respond positively and you don't react badly. You don't take it personally, and you see no as an opportunity and value it. But the one thing that I really get from this motto is understanding that no does not mean never. And so this is how I managed to continue to try and get some things done by so many people saying no. I'm like, yes, I've got my 10th no. That means tomorrow I'll get a yes. So I'll let you know if it works. But something just to consider that, no does not mean never. So how to actually test, if you have an idea, the model for improvement is from the Institute for Healthcare Improvement in the US. We were fortunate that they came out earlier this year and did a 4-day workshop with us, and this is something that we are working with ACI and a number of other pillars to really try and just test your ideas, and it's a safe way to, I guess, be that risk activist. So there's 2 parts to it. You ask 3 questions, and then there's a doing part of the Plan, Do, Study, Act, which is the PDSA. So I'll just quickly go through the questions. Is what are we trying to accomplish? So what will we do, by when, and by how much? So if you have an idea today of something that you'd like to do within your workforce or your community, actually just think about these 3 questions and making it as small as possible to test. And always think about that soon is not a time, some is not a measure, and hope is not a plan. So be specific as possible. How will you know if a change is an improvement? So if we're doing a social media activity, how do you actually know that we've made an improvement or we've made a change? So actually getting some baseline data is key. And how you get that, we capture so much data. It's just what you actually want to pull from our data systems is the best to actually know what you want. And then what changes can you make that will lead to an improvement? And this is the PDSA. And PDSAs have been around for so long, but it's really how you actually just test that and implement this. And this is something I'm working with junior doctors at the moment. And these guys have the best ideas. They come into our system and they know what's working and what's not working. And actually undertaking through this model is keeping small 6-week changes. and trying to improve our health system and connecting with our communities. So the 1-3-5 approach is testing your idea. So it could be a social movement in one place with one community on one topic, and then you test it in 3 places, and then you improve. So you do your PDSAs, and then you do it in 5 places. And apparently, according to the literature, by the 5th time, you should have got it correct by those PDSAs, that you can then spread it across the state or go to scale with it. And learn from groups and spread to others. So this is why forums like this is perfect, because we can really actually share a lot of our key learnings. And something from Google that I actually can see a lot of alignment between our health system and with Google is have a mission that matters. So being specific, being really clear on what we're trying to achieve. Think big, but really start small and strive for continual innovation, not instant perfection. Look for ideas every way, and that's really linking in with your weak ties. Share absolutely everything. So I fail. There's so many projects that are failing, but they're not failure. It's actually key learnings, and how can we learn from that to improve in the future? Spark with imagination, but fuel with data, and be a platform and never fail to fail. So just to recap, if you like, be a rebel, go outside your comfort zone. That's where the ideas are. Really go to the edge and think about your connection and your weak ties versus your hierarchy. Be disruptive. Use your social movements, have the power of one, the power of many. Like I said, use your weak ties, the go for no, try and embrace it, see how you go. And the model for improvement and test is my what I can bring today. So these are my details. I'm more than happy to share any of our key learnings with you. But I know that was a lot of information in 15 minutes, so thank you.